Have you already registered? If not, then quickly.
Welcome, dear viewers, to our format Experience Medicine. Today we're going to talk about the decalcification of the arteries. How does the decalcification of the arteries come about? What kind of decalcification is that? And how do we get the arteries to free themselves again? I'm very happy to talk to our doctor, Dr. Heinz Lüscher. Hello, dear Heinz. Nice to have you here.
Hello, Corinna. Nice to be here again.
Yes, the decalcification of the arteries. The question is, what exactly is decalcified in the arteries?
It is a slow process. This so-called decalcification has little to do with calcium. Calcium only plays a role at the edge. In the arteries, we have fat compounds that stick to the wall of the arteries. Together with thrombocyte fragments. These are the main components, fats and thrombocyte blood platelets. This is what this so-called decalcification consists of.
There's been this myth for years, fat makes fat, counting fat eyes, saving fat, leaving fat. Is fat equal to fat?
No, and this has nothing to do with the fat we eat. Because all the lipids in the blood, of course, have something to do with it. If you eat a lot of fat, more fat goes into the blood. But it is not the fats from the food that stick. The fats are also metabolized and change. It is lipids, triglycerides, etc. that play a role. Cholesterol, we will certainly come to that later, plays a side role from my point of view.
But I can control the production of certain lipids or reduction through a diet?
If you eat really well, not oversaturated, even with bad fats, then it has a positive effect. But there are other risk factors that are simply not in the foreground in medicine. And we have to look at them too. It's not just cholesterol equals bacterial decalcification. The calculation is not that simple. I would like to show that a bit here.
Yes, then let's go straight to cholesterol. How much does it play a role? Are there different types of cholesterol that we can measure? In Germany, there is only the total cholesterol. What do you want with the result?
If we look at the cholesterol, there is the HDL, the so-called good one, and the LDL, the bad one. The bad one is supposed to be responsible for that, and the good one is supposed to protect us. But it's not that simple in detail. My experience is that the really dangerous thing is the oxidized LDL. But that is usually not measured at all. And for me, only when the oxidized LDL is higher, then there is a question of statin. But even then, I first look at whether these arteries are calcified at all. You can look at the carotid artery in the ultrasound. That happens relatively quickly. And when these arteries are free, then I don't really care about the cholesterol level.
How does this oxidized LDL come about?
Yes, that again has to do with oxidation and the chronic inflammation in the whole metabolism. We are practically all oxidized, and these silent inner inflammatory mechanisms play a role here. That the cholesterol can also oxidize.
Okay.
You can't control that much yourself, except for healthy nutrition. A lot of plant substances that are then metabolized, basically. Incidentally, it's not entirely true that you can't influence cholesterol at all with nutrition. I think cholesterol in Germany has a different measure unit. You can certainly reduce it by 300 to 250 with nutrition alone. That would be possible.
Okay, are you talking about total cholesterol or LDL?
Yes, the total. They have a different measure unit than in Switzerland.
Yes, we have 200 total cholesterol.
With us, it is over 5. Total cholesterol is too high. I used to be a GP 35 years ago. The upper limit was 6.5. You can ask yourself, who put it down like that?
With us, it was also 260, 220, 200. We now have doctors who medicate to 90, reduce total cholesterol to 90, and then the question arises to me, does that still correspond to the natural?
From my point of view, not at all, because cholesterol really has positive effects. Cholesterol is the building block of some hormones, not all, but especially the sex hormones and cortisol. If you don't have cholesterol, you can't produce hormones. And I often measure the hormones. A high cholesterol content is often a sign of deep hormones. The body produces, the liver produces cholesterol, the least of a food. And when the liver produces, it tells the body, produce a little bit of hormones, and I give you the building blocks. It's not just fate that has to be fought. It has its reasons. And furthermore, cholesterol is a major active ingredient or building block of cell walls, and especially in the brain. If you treat people to 90, then we damage the brain. That's not a question for me.
Yes. The arterial calcification. Do I have opportunities to get the arteries free again? So to get a regeneration again?
Yes, absolutely. Even if most doctors reject it. That's what I learned. You can't do anything about it. You just have to make sure that it doesn't go on with possibly deep cholesterol levels. There is the Evaporate study, I think it's called, about 5 years old, where they were able to show that you can restore calcified areas with omega-3 fatty acids. Very, very slowly and in high doses. But it was possible. The study showed that, and of course, that's not pleasant for everyone if it happens in a natural way. It takes 4 grams of omega-3 fatty acids. That's a lot. That's really 2 tablespoons of good fish oil. 4 grams. And the study lasted, I think, 4 years. So it takes high doses and a long time. And then they were able to prove that arterial calcification is regenerating. Not completely disappeared, but have become smaller.
I had a few cases where a calcification was really measured, and a high-dose lemon garlic juice was taken, with 18 cloves of garlic and 10 lemons, and there were really brutal effects on the arteries. How can you explain that to you? Were these just random events, or are there really ingredients in there that really explain that something could be cleaned?
I don't know the ingredients, but garlic has always been a good food for various disorders. For circulation, also for preventing cancer and inflammation. Garlic has substances in it that are healthy, but I don't know them in detail. And lemon? I don't know.
Maybe just for the taste, that it's not that bad.
But in general, if you eat more plant-based, you have less problems with arterial calcification. But for me, it's still important, Corinna. It's not just the cholesterol. There are other factors. We know, for example, that sugar is actually the larger component for the inner wall of the arteries than cholesterol. But nobody talks about that. Nobody. The people in Europe are over-sugared. That's a huge factor, and it practically doesn't matter. You only treat diabetes if the sugar is too high. But even normal sugar or daily sugar consumption doesn't necessarily lead to diabetes, but it damages the vessels. Then there's high blood pressure. Everyone knows that. Smoking also damages the inner wall of the bacteria. Smoking is not just about lung cancer, but also about the damage to the arterial walls. It's much worse than lung cancer. And the main cause, as I see it today, is the leaky gut syndrome. What does that have to do with arterial calcification? In a leaky gut syndrome, toxins go through the gaps in the intestinal mucosa. They connect with the blood platelets. In the heart, they are separated again. The toxins are then free, floating around in the blood. The same receptors occur in the arterial wall as in the thrombocytes. These toxins then stick to the arterial wall again. And if you now, these are so-called lipopolysaccharides. If such a substance sticks there, which was also brought by thrombocytes, now a thrombocyte comes by, it sticks to it, and then maybe another polysaccharide comes, and so on. So here something builds up, especially in the thrombocytes, and the lipids are added. But actually, the original beginning of arterial calcification was the leaky gut syndrome, where these lipopolysaccharides ended up in the blood circulation. This is not an acknowledged theory in school medicine, but for me, it is very plausible.
Yes, it makes sense. It sounds plausible. What do you do when someone comes to you with an arterial calcification? What are the parameters that you determine in the blood? How do you regulate what with which therapies?
Well, you measure the whole fat metabolism, the cholesterol, with the subgroups. The triglycerides show me how the patient is nourished. The deeper, the better. Sugar has to be measured. These are the main factors. And then the anamnesis, how he lives, intestinal anamnesis, smoking, blood pressure, all that is part of it. And with the fats, I can regulate a little, mostly via nutrition, more plant-based nutrition. And for me, a slightly increased cholesterol, now in Switzerland, for 775, absolutely no problem.
Do you also look at the LDL, HDL? Do you have that too?
Yes, LDL is the worst, of course, and the higher it is, medically, based on the knowledge, I would have to lower LDL to 1.8 in Switzerland. I don't know the number in Germany now.
I think we have 150 there.
Yes, that would still be possible. But the goal, I heard recently in a further education, is 0 at LDL. Research is being done on drugs that bring it down to 0. That is life-threatening for me, because I also look at the good effects of cholesterol. But that's the future. I myself have a cholesterol level of 7.5, an LDL of 5, and I have no problem with that. I enjoy it because I can exclude all other factors.
Yes, of course. We also have a study with older people who really have a slightly increased, from our point of view, from the medical point of view, increased cholesterol value, were cognitively and coordinately much fitter than those who were artificially reduced. And then you have to look, what were the first cholesterol studies? With chickens and who knows what.
Yes, from the 1960s, egg yolks and butter, that you shouldn't eat all of that. That has long been researched, what lies were behind it and what economic interests were behind it. You can really forget that. But it's incredible how these misinformation still holds up.
Yes. If someone says he really wants to strengthen the vessels with alternative options, also preventively, that the vessels remain supple, remain flexible, simply that nothing can stick to them. What are your measures?
Exactly. You need a combination. We need several substances. I already said omega-3. We don't just need it to restore atherosclerosis, but also to protect the blood vessels. Before you have atherosclerosis, you can preserve yourself with omega-3. But it is supported with OPC, for example. OPC is a grapeseed extract. We need vitamin K2. Omega-3, K2, these are the three.
What is the difference between K1 and K2?
They are two completely different vitamins with completely different properties. K1 is especially important in the blood coagulation system. K2 only does that on the edge. K2 has a protective effect on the blood vessels. K2 is also needed to better process vitamin D.
Yes.
So this is my recipe, omega-3, K2, and OPC in high doses. And so I can protect the blood vessels. This is what I do myself. Because I have high cholesterol, I have to make sure that it doesn't harm me. And so far, it has worked well.
Very good.
My cervical arteries are completely clean when I look at them in the ultrasound.
Yes, and that shows exactly the factor. And to what extent does blood pressure correlate with vessel calcification? Is there a connection?
Yes, because high blood pressure forces the arteries to resist. If you press more water into a tube, then the wall has to press as hard as possible so that it doesn't burst. And this is also the case here. The blood vessel pulls together to resist the pressure. And this tension of the blood vessels leads to the fact that the inner layer allows the adhesions to be a little easier. And then maybe calcium. If you take too much calcium, it is deposited in the wall of the arteries. But this has nothing to do with the calcification on the inside, but the arterial walls become stiffer, and this causes higher blood pressure, and as a result, more calcification. So don't take too much calcium. 400-500 milligrams is okay, but certainly not 1,000 milligrams. We also have a few hundred milligrams of calcium in food and in water.
Speaking of water, sometimes you hear statements that the calcium in water or calcium in the arteries would worsen or have an influence on it. I've heard that a few times from people, some of whom really maintain this.
No, of course not. Calcium in water is deposited in calcium. Indirectly, too much calcium is deposited in the blood vessels. But in the stuffed material that can be taken out and examined in the lab, there is no calcium in it, which is exciting. There are studies that these calcifications of the material have been operated on and then examined in the lab. There are only traces of cholesterol. These are completely different lipids, different fatty acids, together with fragments of blood. So relatively little cholesterol. If cholesterol was the only factor, these lumps wouldn't consist of cholesterol. And they don't.
Yes, it's still an exciting topic. So I think when I listen to you, it's really like this. When I prevent with plants or integrative medicine, How does someone deal with someone who already has an arterial calcification, who is medically adjusted and would like to have the change in the regeneration area and really reduce the chemical drugs?
So if someone already has really severe calcifications, then I remain the cholesterol-lowering drugs. Because cholesterol, or the statins, the drugs, have a stabilizing effect on these calcifications. If they are soft, they have the tendency to release and form embolism. And if you then give a statin, they harden and they are secured so that it's harder to wash them away. So there are moments when a statin is absolutely useful. And if someone has a lot of calcification, he probably also has some soft spots that should be improved. So for someone who has a lot of calcification, I do mine also, but I also recommend to take the medication for a long time until I can see that it has improved. And yes, in very severe cases, you can't do much anymore, but it makes sense to look at it beforehand. And with ultrasound, you can see relatively well whether a vessel is free or not.
If someone says he wants to have a look at that topic, is there maybe something to read a little about it? Are there any possibilities?
Yes, there are whole books on the subject, of course. On my website, vitalstuffmedicine.s, I always have specialist articles on various micronutrients, vital substances, and about cholesterol also one. If you want to get informed, there are 2 or 3 pages. But you can go as far as all the big books on the subject.
Yes.
So OPC is perhaps also a topic where there are so many products, and measuring OPC can be done in various ways, and most companies measure it in a way that best reflects their product, and that's not always the case. My product is the Vino Vita. It's 150 milligrams, really good OPC per capsule. And resveratrol, which also protects blood vessels, is also included. And with omega-3, it's just a good oil, algae oil, or fish oil. It's important that it's free of heavy metals. There aren't many on the market. Yes, and K2 combined with vitamin D. Vitamin D is not in the foreground for atherosclerosis, but for the heart itself. The heart muscle also needs vitamin D, and you need a healthy heart to circulate through the whole body. And last but not least, if someone really has a strong atherosclerosis, the blood pressure is higher, and it has to stay higher, because these calcified vessels allow less blood to pass, and organs, especially the brain, still need a good circulation. In these cases, we need a higher blood pressure. So to reduce the blood pressure to 120 with an advanced atherosclerosis, that's wrong. These people have extreme dizziness, fatigue, and are undernourished with oxygen.
Exciting. Again, a good reaction from the body. You have to see the whole body.
Always. That's what I criticize about the specialization of medicine. If you only look at one organ, if I look at the cardiological suggestions, then I say yes. For the heart, if the heart is supposed to be 120 years old, then these are good suggestions. But the holistic view is in the foreground. This is the case in integrative medicine everywhere. We look at people and not at the individual organ.
Yes. Thank you very much, Heinz. I look forward to the next time. Until then, all the best, and nice to have you here.
You too.
Dear viewers, I hope you were able to take some tips with you. A few tricks and tips maybe preventively so that not so much can be stored. Thank you for watching. See you soon. Bye.